to the next session at Giant Health on stage one, and it's my great pleasure to welcome Microsoft, and Alex and Joe are going to talk us through the next 30 minutes, and then Phil's going to come on and show us more about HoloLens and its actions. And the idea is at the end of, towards the end of Phil's session, there'll be an open Q&A with the audience. So you're very welcome. Alex, over to you.
Thanks, Shane. Much appreciated. My name's Alex Cream. I'm the Metaverse lead for Microsoft UK, and I'm here with my colleague Joe Verasso, who's the EMEA partner lead and healthcare lead for mixed reality. We've got a few topics to kind of go through today. Unfortunately, there's a bit of a last-minute change on our kind of speaker. We had Hamer, our EMEA CTO, going to join us, but at last minute we've kind of tweaked the content. And I think it's actually quite interesting to talk specifically about sustainability and then mixed reality together. I've recently actually returned from COP26, where I was on the Microsoft stand and having a really enjoyable set of conversations with lots of different people on sustainability, what Microsoft's doing and what we're doing to help support people around the world. So, what's Microsoft's mission? So the key thing for us is to empower people and individuals to achieve more, right? When Microsoft first was founded in the 70s, the kind of overall mission statement was to put a PC or a computer on every person's desk. And in the developed world, that's mostly been achieved. So in the last few years, under Satya Nadella's leadership, we have pivoted towards empowering people, providing solutions that are actually going to be able to empower them to achieve more within their kind of realms, with one of them being obviously healthcare, as we're here to talk about. But when we talk about sustainability, you know, it's a planet-sized problem, right? And planet-sized problems require planet-sized solutions. And that's a key thing to kind of talk about, is that when we talk about sustainability, what are the kind of key 4 pillars as Microsoft sees it? And this is really cool, and this is a really powerful thing that we were talking about at COP26. So there's 4 key pillars as Microsoft sees them when it comes to sustainability: carbon, water, waste, and ecosystems. So if I talk about what Microsoft's doing in each sphere, I think that kind of gives you a little bit of an understanding of what we talk about when we talk about those themes. So carbon, first of all, carbon reduction. So Microsoft's made the pledge to become carbon negative by 2030, so to absorb more carbon than it emits by 2030, and then to remove all of the carbon it's ever emitted since its founding by 2050, which is a really bold ambition. Water. One of the key things is as the planet begins to heat up, if we don't do action, then water is going to be a key commodity. And so being water positive, i.e. consuming less water than you produce, is going to be a really key thing. And there's a really cool case study that I'd advise you to have a look at regarding our new office in Silicon Valley. That's actually the first office that's been certified as water positive. And so through water treatment on site and collection of rainwater, it's actually drawing less water than it actually physically produces, which is really cool. Waste is obviously a key one, and we talk about electronics and we talk about healthcare as well. There's a lot of waste that we need to reduce. I think that one's fairly straightforward. And then protecting ecosystems. You know, when we talk about sustainability, it's not just about carbon reduction, it's not just about water, but also about the ecosystems and the environment. So it's key kind of 4 pillars for Microsoft. And when we talk about healthcare specifically, there's some really interesting statistics that I thought I'd call up, because 4.4% of global greenhouse emissions are linked to the healthcare sector, which is actually quite a significant amount, as you might not have been aware. And of that 4.4%, 71% is due to the healthcare supply chain, which is really something that we need to have a look at. As you can imagine, as the planet heats up, there are more deaths that are going to be associated with climate change and with pollution and things like that. So that's a statistic. Up to 250,000 deaths are expected by 2030, which is quite significant. And 35% of all medical waste is actually plastics, which is something we need to have a look at. And so what's the actions? What can we do to actually to change this? So Microsoft actually has the 5 R's, and I always get them in the wrong order, so I'll look as I'm reading them. Record, report, reduce, replace, remove. So if we think about where we are today, how do we actually take action? Well, we need to know where we are today, and we need to use data and insights to do that. So we need to record what we're doing, and then publicly report exactly what our current state of affairs is regarding carbon, water, sustainability. Then we need to use that data to understand, okay, what do we need to reduce? What processes do we need to replace? And then ultimately, what do we need to remove from our kind of processes and our organizations? And so at COP26, we announced one of our kind of key products in the sustainability portfolio, which is called the Microsoft Cloud for Sustainability. And when we talk about the data aspect and the insights, the Cloud for Sustainability is effectively a central data repository that organizations can take advantage of to measure and report on exactly what their current state of affairs regarding sustainability is, and then ultimately use AI and analytics to provide insights and actions to say what we need to do to change regarding your entire supply chain. So it's a really cool set of services. It's effectively a software as a service platform that organizers can take advantage of. It collates all data into one central repository and then provides you all of the data and the analytics and the insights that you need to take action, which is really, really cool. So at this point, I'm actually going to play, I would say a quick video, but it's about 18, 19 minutes, but it's from our Chief Medical Officer, David Rue, and he's going to talk about mixed reality, which is one of the key reasons we're here today at Giant Health. So what I'm going to do is I'm going to play the video from David, and then, yeah, we'll be joined afterwards by Joe. So.
Hello, my name is David Rue, and I am the Global Chief Medical Officer for Microsoft. I'm a physician, a technologist, and a health services researcher. Over the past 25 years, I've studied how technology can be used to improve health outcomes, specifically access to care, quality of care, patient safety, and ways to improve the patient and provider experience. I'm excited today to be able to share with you how mixed reality can be used to transform healthcare and improve outcomes. To do that, I'd like to share with you some slides and some videos. So let's just jump right to that. The real exciting things about mixed reality is that the imagery and the visualizations give you the sense that you are actually there and that these animations are real. It allows us to be able to immerse ourselves into environments and be able to think of ways that we might be able to interact with each other and the environment in ways that we've never thought of. Now, oftentimes this is viewed in the context of entertainment or fun and exciting things. But what we've also seen is that there are several use cases that could be relevant for both clinical practice, education, and training. But before we jump too far into this, I wanted to provide a disclaimer regarding the things that I'll be talking about as part of this presentation. I'll be covering both slides and sharing videos, but largely this is about the art of the possible. These are things that could potentially be done with the platform. Now, in some cases, we have partners, ISV partners that have built on the Microsoft platform and leveraging the Microsoft tools to be able to create immersive experiences that have been validated and approved through regulatory mechanisms and are now marketed for certain use cases. I'll showcase some of those. But what we also want to recognize is that there's a desire for Microsoft to be able to provide the platform, but not necessarily replace the clinical decision-making that clinicians have. We also are looking to make sure that we are not making any claims regarding the accuracy, safety, and the reliability of the technology and the platforms as it pertains specifically to the mixed reality clinical use cases. Now, with that said, let's just jump right into it. And let's talk about how mixed reality can empower every individual and organizations across the planet to be able to achieve more. In order to do that, let's start thinking about the paradigm of healthcare. In fact, there are many things that we look at healthcare as being tried and true. These are sayings that oftentimes have been instilled into our daily practice, one of which is see one, do one, teach one. This was coined by Dr. William Halsted in the 1890s, and it specifically referred to the fact that clinicians in the course of training need to see several types of procedures. They need to see several types of patients with certain conditions. And then they need to perform the procedures on the patients and gain some expertise. And then eventually they get to the top of the pyramid where they're able to communicate and teach others how to do this. As you can imagine, this is a very narrow pyramid. It doesn't allow us to be able to scale this. And unfortunately, that has created problems when we think of access to care. With virtual reality, with mixed reality, augmented reality, we have tools now available to us to be able to create immersive experiences that can transform the opportunity for providing education and training. What we want to also recognize is that the devices that we now have available that allow us to be able to change the way that we see the environment, to be able to see three-dimensional images and be able to understand how these images can interrelate with each other. It allows us to be able to not only see it, but potentially change the way that we look at the world. This is a quote from Satya Nadella, the CEO of Microsoft. When you change the way you see the world, you change the world you see. And that's exactly what we're talking about here with mixed reality. In the context of clinical use cases, we are going to focus on three. The first is around holographic patient consultation. And what that really means is in the course of talking to the patient about a procedure or a particular type of intervention, we oftentimes need to communicate information in ways that go beyond words. A picture would be great, but a three-dimensional interactive picture that one can look at that may be specific for them is exactly what patients need. Now, in the context of consultation, we'd love to be able to bring consultants in on every visit. It's impractical to be able to do that. But with virtual care and with some of the tools we have now available, we can do remote expert consultation and have them available all at the time that we're seeing the patient, and have those consultants be able to see the same type of things that the individual clinician is that's standing right in front of the patient. And in terms of training, simulations that allow us to be able to understand the different anatomies, to be able to provide procedures and enable junior clinicians to be able to practice in a safe setting, but also teach them the proper way to do things and avoid certain aspects that could lead to danger. That's something that we now have available with these mixed reality applications. So what I'd like to do is I'd like to start off first talking a bit more about the technology that underlies a lot of this. Now, when we think of mixed reality, probably the very first thing we think of is the headset, the Hololens or the Hololens 2. And that is a core part of what we're talking about. But the imagery, the analysis is actually being done in the back end with a powerful platform on Azure. It's called Microsoft Mesh. And that allows us to be able to create the three-dimensional images, that allows us to be able to pull the data from the different sources and be able to provide that level of interactivity and immersive nature. Additionally, Microsoft Mesh interfaces not just with the HoloLens, but a variety of other types of technology tools, such as PCs and mobile devices, as well as other virtual reality headsets. So we can create an ecosystem of different types of devices that can be used by clinicians and patients as they're immersing themselves or working with individuals that are in the immersed environments. And then on top of that sits the applications. The Dynamics 365 has allowed us to be able to create immersive experiences that connect us to different individuals. We now have Microsoft Mesh apps, Altspace VR apps, and of course, partners are building on these platforms and creating incredibly immersive and important types of clinical applications using the Microsoft technologies. And that's what I'd like to share with you, some of those partner solutions in the healthcare space that are really transforming the healthcare industry. So let's start focusing on these partner solutions. The first is around holographic patient consultation. As I mentioned before, what we're doing is we're going beyond simply showing a picture, but creating an interactive tool for both patients and providers to be able to communicate. And in this example, what we're going to be talking about is the Microsoft HoloLens 2 combined with Applicar's Virtual Surgery Intelligence, or VCI. So let's take a look at this video to understand a bit more about this.
Medicine is in the midst of digital change. Mixed reality and artificial intelligence are already improving patient care today. Virtual Surgery Intelligence, or VSI, is doing just that. With this software solution, MRI, CT, and other medical scans are displayed in 3D in Microsoft HoloLens 2 mixed reality glasses. This gives the patient a deeper understanding of the results, surgical procedures, and treatment methods. Before surgery, the doctor uploads the CT and MRI data onto HoloLens 2. The VSI recognizes the patient through anatomical landmarks and positions the stored image on the surgical site with millimeter precision. During the after-surgery round, the patient's data is quickly retrieved and displayed using VSI and HoloLens 2. At a glance and without a computer, the doctor can concentrate fully on the patient, answer questions, and discuss follow-up medical care. Being able to easily dictate a report, take photos, and retrieve archived images saves valuable time, facilitates everyday life in the hospital, and provides quality assurance. That will also make other processes in the hospital more efficient. VSI and Microsoft HoloLens 2 define a new medical standard.
So what we saw there were two important use cases. The first was around pre-surgical planning, using the HoloLens to help understand exactly what the procedure would involve and educate the patient as well. And then the other was after the surgery or after the procedure, now taking a look at all the different ways that these technologies can be used to improve operational efficiency, but also imagine being able to pull down the images from the CT MRI, recreate the new structure and compare that to the old. These are the opportunities for how we can apply this in the clinical setting. Now, one other thing that we've seen is that with this type of technology, we can also provide consultation where experts and other clinicians can all gather around the patient virtually and provide their input. Now, this was something that we had seen take fold during the pandemic, which the Microsoft HoloLens 2, in combination with the Microsoft Dynamics 365 Remote Assist, enabled clinicians from the National Health Services to be able to take care of COVID patients. What I'd like to do is I'd like to be able to show you a video that was provided to us by the NHS Imperial College Health to be able to understand a bit exactly how this was deployed.
The concern was that we were going to have mass casualties with thousands of people dying and that the hospital was going to be overrun. And it was immediately obvious that we were not protected, we didn't have enough PPE, and so there was a lot of fear that actually we were all going to get really sick. And then in the second week of March, that's exactly what happened. You know, we lost a third of our team in a week. I was sat there at the beginning of the COVID pandemic and I counted 29 people in a close proximity in a single trauma call. And I was thinking, well, if this is how we're going to run the next few weeks, a lot of people are going to get sick and we have to change this really dramatically. The simple concept was, look, we're going to create completely virtual ward rounds. Rather than sending 4 people, we're going to send 1 doctor in. We very quickly started working with the headsets to identify some use cases. So when you place the headset on your head, what the user will see is a virtual screen or a mixed reality screen, which they can position into any real space in the room that they're standing in. And on that screen at the moment will be the face of one of their colleagues who will be interacting with that user through a webcam based on a desktop. We can call other experts that we might want to call into that clinical scenario. And we can also pull up images and content. So we can look at electronic healthcare record data or x-rays or images. And what it means is that you have all the information, all the specialist care that you need at the patient's bedside, there and then. And it's all in one headset. When this crisis hit, it became apparent that the NHS had to work in a different way, and through really high-level strategic kind of digital infrastructure projects, Teams was just nationally adopted by the NHS. Teams really is now, I would say, an essential tool. We could not run our organisation pretty much without it. The fact that their staff are safe, their ward rounds are really efficient, and that they can communicate more effectively with their staff. COVID-19 will change everything forever in terms of the way we work and how we work. In terms of mixed reality, HoloLens 2 really is the only viable product that we have in the space. And I can see a point where these sorts of tools will be the norm, where you will go on a ward round, or you will go into a clinic, or you will go into an environment that might be high risk, that might be challenging, or where you might need specific capabilities of these sorts of technologies, and it will be there, and you'll just use it, and it won't be a novelty. What I'm absolutely convinced of is that we are just at the very beginning of a very long and exciting journey. And I think what's been very important about COVID is actually it's just given us a real shot in the arm and a huge step change in our perception of these technologies and what value they might bring.
Looking at now opportunities to apply mixed reality in a real world setting to be able to provide that level of virtual collaboration. There's actually been studies that have been performed on this to show the significant reduction in PPE as well. So in addition to protecting the clinicians from exposure to the virus, what we've also seen is a significant decrease in PPE or personal protective equipment. One other area is augmented teaching. And this is an opportunity for us to be able to apply mixed reality to individuals that are in the course of training. It could be medical students, nursing students, pharmacy students, anyone that needs procedural training, as well as residents and other types of individuals that are junior faculty. It provides an incredible opportunity for us to be able to help us understand everything from the anatomy to surgical procedures. And again, this scenario is a combination of the Microsoft HoloLens 2 technologies with, in this case, Interactive Commons Holo Anatomy application. And this was done and tested at the Case Western Reserve University. What we saw with the Case Western Reserve University analyses was that the students that were using the Holo Anatomy solution with the HoloLens 2 had a 50% higher retention rate and 40% less clinical class time. So an extraordinary opportunity for us to be able to enhance and improve the efficiency of teaching for clinicians. Now, let's get back to what we just talked about before, the technology that underlines this. Much of what we're talking about here is in the context of Microsoft Mesh. It is on Azure, so there's a significant amount of AI that's been applicable, but we've also built on top of that. And on top of that, we've created an opportunity for individuals to be able to collaborate. Imagine being able to go into a virtual conference room, have an image of the particular organ in 3 dimensions in front of you, and rather than all of the participants being there just through a video conference, their avatars are there, and the avatars can interact with the actual organ, be able to then dissect it, show particular areas, have people look at different angles. This is what is possible now with Microsoft Mesh. And more recently, Microsoft has announced that Mesh can be launched directly out of Microsoft Teams, which gives us an opportunity to be able to then leverage the fact that individuals and organizations are now leveraging collaboration tools such as Teams for telehealth and virtual care, and then launch into these environments. An incredible opportunity to provide intersection between the different Microsoft products. And that's exactly what Microsoft is doing. We are taking a look at all the different technologies that we have available today, everything from Azure to Teams to Dynamics, and all the platforms that we have built on top of it, including Mesh, and integrating them all. But at the center of all of this is healthcare data. And if we think about how healthcare data needs to flow from all the different systems, a great way to visualize it is with this circle or this diagram in front of us. Imagine it being divided into 3 parts. In the upper left-hand part, we're now talking about insights and the ability to understand the individual at a very personal level. That means we need to pull data, not just from our environment, but also from the electronic health record, from other data sets, and normalize that through open APIs and FHIR standards. In the process of bringing all these different data sets together on a common platform, we now have the ability to apply artificial intelligence on top of it. And in that context, we can apply more than just simply the context of what we know to be visualization of the imagery, but we also can potentially apply AI to transform some of the information into decision support, ways that we can now act upon it. And then from there, it needs to be collaborated and coordinated. And that is something where the collaboration tools that we've just talked about can be incredibly helpful. Part of what we're now talking about is a transformation of how virtual care is being combined with artificial intelligence. But what we are also seeing is that there are other virtual care and AI tools that we can have at our disposal. We have seen chatbots and the rise of the information, the need for consumers to be better informed, all being brought into a virtual care environment. We've seen the use of voice technology being converted from voice to text, understood who's actually talking, and then from there, the AI will allow us to be able to structure that into a clinical progress note, which then can be integrated into the medical record. This is also something that has been launched during the pandemic as part of the ambient clinical intelligence technologies that are now embedded into Microsoft Teams for virtual care, we have now an ability to transform the way that virtual care is delivered by bringing AI and ML into the technology suite. So now what we're talking about is an opportunity to reimagine what healthcare can be. We're getting better insights by connecting surgeons and clinicians with the medical data that matters most. Better experiences. Now surgeons or students can perfect their skills by practicing on virtual tools that are in 3 dimensions. And then providing better care by allowing us to be able to provide preoperative planning, postoperative analysis, and better information that's provided to the patients as part of this overall experience. And throughout this all, what we are learning is that mixed reality has an incredible potential to transform the way that we take care of patients and that we train clinicians across the world. Thank you very much.
Thank you, David. Okay, Joe Verasso here. I look after the mixed reality partners in Europe. Some of those partners you saw highlighted there, and as well as Insight, who you'll hear from shortly, and some of the partners at Insight stand. I've been developing the ecosystem and particular focus on healthcare partners. We have small startup ISVs through to large integrators. I've also been working closely with the NHS since the start of COVID. You saw an example of the work there at Imperial College. In the early days, the partners got together to see if we could address some of the challenges that we were facing here. So one area was around education and addressing the skills gap, and you'll hear a bit more about that from Phil and the work that we've been doing with Health Education England. But also in the clinical setting, such as ward rounds. We set up a knowledge sharing call that's still going, and any of you who are interested, please approach me later, that Health Education England host, and we can share the knowledge amongst the different clinics and trusts. As we put this technology in the hands of the clinicians, they find new ways of using it. So whether it's within the hospital itself in acute care or out in secondary care and connecting to the community. So we're seeing wonderful examples of that. And again, you'll hear a bit more from Phil. But in the last couple of minutes, I wanted to also share with you some of the work we're doing with the Holomedicine Association. We've been hearing that there is a need to really support the industry, share best practice. So we helped found this independent organisation. It is now recently just had its inaugural summit on Saturday. I encourage you to go to the website very soon. All the content will be available to be downloaded. We're seeing some incredible applications of this technology from hospitals around the world, using it in the clinical setting as well as education to augment surgeons for surgical planning and also looking at applications in the future for image-guided surgery as well. So this organisation is really addressing some of the challenges in getting a greater adoption. So looking at certification, looking at policy, how to make this technology really mainstream, and so that when a doctor prescribes, they might actually prescribe a virtual reality or a mixed reality solution. We can see also the importance of sharing best practice and encouraging research and efficacy. And so I also encourage you to go to the website. These are some of the initial founding partners. Apocular, who you saw presented earlier, also the RPP group, who specialise in working with government policy and certifications. But this is open to industry to also join and support, because we really want to foster a industry body to advance this technology. Link to the website, and come and talk to me later. We're having a short Q&A now after you hear from Phil Moore from Insight, and Phil's going to talk about really how to make this real. Thank you.
Right, are we on?
Yep.
Yeah, great. Thanks, everybody, and good afternoon it is just. So, spot on time. So I'm Phil Moore, I'm the Digital Innovation Lead for Public Sector for Insight. For those of you who don't know anything about Insight, just briefly, we're a global organisation, big Microsoft partner. We resell all sorts of hardware, software, etc. But increasingly, we're also delivering the value-added services that help bring a lot of these things to life. And with Immersive Tech and with Hololens, that's something we've been really active on in the last, particularly the last sort of 20 months or so. So I'm just going to do a quick sort of review of some of the things that David and Alex and Joe mentioned and echo some of their comments, but also just to sort of dig into a little bit more of the detail and show you how to go from sort of A to B. You've seen some of those great applications in use there. I'm just going to talk to you about some of the methods to get you from that kind of A to B to using them in a small scale and then how to take them out at scale. So HoloLens 2, just for, you've seen it in action there, but what is the device? Well, that is it. Basically, it's a Windows 10 computer that you strap to your head. It's got compute and storage at the back. It's got built-in microphone, built-in speakers. It's got video camera at the front and these holographic projectors that allow you to see these 3D images as if they were in the room. Now, one thing that's really great about this device is it is self-contained and totally wireless. You don't need a PC to plug it into. There's no hand controllers. It's totally there. You just have it on your head, lift it up, fits over your glasses, and then it sees your hands and follows your hand movements, and you've got hand gestures to control it. It's also voice controlled. It's got eye tracking. So there's a number of different ways you can interact with it. And it's a really different way of interacting with technology, and that's a great thing, but it also presents some challenges just on getting people using the stuff. So I'll just flick through those. So that's a quick run through of the sort of things that it does. And it's got built-in security as well of iris recognition, so it knows who you are when you put the headset on. Battery life in about 3 hours. But so why now? Why is this starting to really take hold now? Well, there's a number of things that were coming together. So we obviously had the pandemic, and there's major disruption on clinical work, on medical education. But then there's the introduction of the second version of this, the HoloLens 2 in late 2019, which was really timely. And then with Teams being rolled out across the NHS in March, a lot of things were now starting to come together. And with remote assist, which I'll touch on in a moment, that was helping sort of bring more of these things together and making these things, rapid deployment a real reality, which was something that's really required at the time. And as Joe mentioned, there's this cohort of early adopters that were seeing value in this and then starting to share information around on this. And this really helped get the interest together and helping people help themselves to get going with it. And then we've got the emergence of these other immersive technologies, mixed reality, virtual reality, third-party apps, the ecosystem growing. And then we've all seen recently, the hype around, the metaverse coming in. Facebook changed their name to Meta. David was talking about Mesh, and all of these things really starting to give it some momentum and some a real push. And an example of that here, this is from one of our partners, Joint XR, who we've got down on our stand downstairs. An example of this metaverse of having a combination of real world and virtual world. That's Rafa from Alder Hay in there, his virtual avatar collaborating with somebody else in a different room around a 3D image of a heart. And if you want to go and see that, you can put a headset on and see it down on our stand. So a couple of the Microsoft products that have been mentioned, Remote Assist has been mentioned, but there's also a thing called Guides, and I'll just touch briefly on both of those. So Remote Assist, how that works, that's basically the glue between a HoloLens headset and the Teams environment. That allows the user of the HoloLens to join a Teams call, and you see the other people on the Teams call see what they're seeing through their eyes, and they can have this two-way communication and collaboration. And that is really easy to set up and get going. And some of the use cases, we talked about those on that video, the virtual ward rounds, there's MDTs, expert opinions. virtual clinics, streaming from maternity when partners weren't allowed in the delivery room, for instance, friends and family contact when people weren't allowed on the ward, and that's the case from a children's hospital, to enable you to have that contact. And then there's other things, maybe not so clinical, but equipment setup and maintenance when you couldn't get on site, or you just needed a hand with it. There's also things outside of acute, in community. So for wound management, we're just embarking on a project down in the southwest of putting HoloLenses in care homes with care assistants so that they can do lower acuity wounds with the online supervision of a community nurse, for instance. And it helps them to do that audit of the best practice and to keep going, and the ongoing training. Virtual GP visits into care homes as well. And we're seeing occupational health assessments as well now coming in, of doing that in advance of discharge from hospital. And then in the education, some of those use cases have been discussed, have been about simulation and remote bedside training, streaming of surgery and other such things. And we've been working with Health Education England over the last year or so, as they've really seen the value of this and really driving forward with it. And I'll talk more about some of the things that we've done with them later. But guides, I wanted to mention about guides, this other first-party product from Microsoft. So what is a guide? It's basically a 3D sort of holographic training guide. So you're superimposing the virtual world onto the real world. So an example there was with a bit of machinery. Somebody's wearing the HoloLens, they've got their machinery, but then they're seeing instructions appear in front of them. They're seeing pointers going down onto that bit of equipment to show them what to do. You can embed video in there, you can have checklists, you can review how well people are going through those instructions. And this is starting to be used in the clinical world as well. And so we're delighted we've got visitors here over from the States, from the University of Michigan. So we've got Deborah and Jeremy and Jim, I think it is, at the back there. And these are some of the use cases of where they've been using guides for training of nurses. So starting an IV, placing a urinary catheter, etc., and you can read the list on there. And I think, Deborah, you said you've got 1,800 nurses you've put through these processes? A little bit less. But heading towards 1,800, so a lot. And we've been talking about how we can maybe start developing more of these sort of things and sharing the guides around for different procedures. And within that could be a really worthy thing to do. And the Sheba Medical Center in Israel, they've been using HoloLens and guides to set up ventilators in ICU. And quote from one of the students about, they're talking about using these 3D holographic methods, work on different areas of the brain. You hear it, you talk, you see the presentation, you see it in front of you, you can visualize it, you can do things. It can be quite kinesthetic. And the more senses that you use, better the brain can recall that. And I think it ties into this thing about the cognitive process. This is something from a Microsoft document about this embodied cognition. Digitally immersive experience enables students to practice things before doing it in reality. So you kind of build up some confidence about the methodology that you're doing and some of those processes. And you can do that in a safe environment. And this mastery side of things, being able to repeat things as often as you like. You can have facilitated learning by an instructor, but also self-directed study as well, and self-directed practice. And it's on this cognitive load about mixed reality, reducing these bottlenecks in the brain, increasing performance of developing these new skills. And it's proving to be really effective. And I think the work at Health Education England that they're doing on using mixed reality immersive tech in clinical training, they're developing an ongoing evidence base for just to see how effective all of these things are in different settings. So we've been working on this stuff for the past sort of 20 months or so, and some of the lessons learned from this, some of the considerations that we see for getting started. There's a list of technical things that you need to consider on licensing, your team's environment, how you manage these devices and the information governance beside it, connectivity and a range of other things, and infection control to get it through those things. A lot of these hurdles have been overcome, but they do need to be considered. But then there's the other side of it, the business side of it. of understanding the personas and identities of the people using this equipment. What are their roles? How are they using this stuff? What are you need to get some sort of empathy with the users about how they're experiencing this. And then to look into these use cases, of which we've seen there are loads of different use cases, but then to really map those out so you know discreetly. Am I getting the nod there? We're good? Okay. And then started off of identifying what your success factors are before you launch into a particular POC, so you know you're collecting the right evidence as you go along. And then we'll talk a bit more about adoption and change management, how to do that at scale in a moment. So what we did in response to this, Joe contacted us early last year, and in particular we talked about Hologaphic. They bought some of the devices, but maybe there was a few short challenges around the deployment of them. So we responded by developing a quick one-day service to help an organisation address these technical considerations and address the business considerations and get them up to the point of being able to run their first remote assist call in as short as a day. Providing things go in your way and you can get through those technical considerations. By the end of the day, you can have people actually running a virtual ward round. It's tremendous the speed of deployment that you can get going with. So that's something we did. Hologaphic was one of the first organisations that we delivered that to, and we've done many others since then. Then we moved on to this issue about how do you prove the value of this. It's great to have whizzy technology, but you need to get clinical value and financial value out of these things. So we came up with this 30-day sort of proof of value service where we do the fast start at the front end of it to get you deployed and to identify the use cases, then let the users loose for maybe like a couple of weeks or so where they go and try things out. Then we get them back together and do these design thinking based workshops where we look at their experience and looking at how you can go forward with it. And at the end of that, there's a plan for either for the wider deployment or for some custom solutions or for some third-party solutions. So with design thinking, for those of you that are not familiar with it, you're trying to get the intersect of these three areas of the desirability of a certain function from a human perspective, the viability from a business perspective, and the feasibility from a technical perspective. And you do need to get all three of those to combine to make these things work. And that's where the innovation happens. And how these things look, in the previous times, we'd just get a big whiteboard and getting everybody in a conference room and stick yellow stickies on for all of the ideas. We run these virtually now. We run them online. And people write these virtual sticky notes. So it's a facilitated session. So we do some retrospection. We look at what were the business problems. We look at some immersive opportunities. We look at the constraints that people have seen, etc. And then we start to move into some ideation, the art of the possible. What else could we use this for? Identifying some business problems that might be applicable. What sort of business outcomes would we want to achieve from this? Started looking at these user personas, getting some empathy with them, understanding how they might be feeling, what their constraints are. So look at their needs, their frustrations, the goals, their working environment and all those sort of things. And then we get people to vote on the different use cases that come up. And then that starts to narrow down on the priorities. And at the end of it, we run these sessions, maybe a couple of half-day sessions on that. And then we do a playback report on that with the priorities, and then you've got some prioritised next steps that have got some structure to it. Because the nature of this technology is you can go off in all sorts of directions. There's so many possibilities. But you do need to kind of rein that in a bit. And, OK, let's get down to some good, tangible next steps that are going to deliver value for us. So that's getting through your initial proof of concept and getting those first use cases done. But then you've got the challenge of rolling out at scale. And it's one thing to get an enthusiastic clinician to adopt this and do a pilot in their particular area. They're on board, they get all of this and they love it. But then when you're trying to roll out at scale with people who've maybe not been involved in that process and not maybe quite so tech savvy or not quite so keen on these things, it can be a bit of a challenge to get the adoption at scale. And we see this with all sorts of technologies. This isn't just immersive tech, this could be anything. So we take people through this process, the ADCAR process, as part of the ProSci methodology. It's a proven methodology for getting technology adopted at scale. So more than just training, it's starting off with this awareness, the need for change, making sure that the business need is understood and well communicated, getting that desire of the individuals to change, getting their personal motivation up to speed. And then you get through the knowledge and the ability, which is where the kind of the traditional training side of it sits. But you need these bits to happen first of that to get the acceptance of that. And then there's the ongoing reinforcement of the activities. You know, making sure people, this isn't just a flash in the pan. It isn't just the latest a bit of whizzy technology that somebody's seen and wants to impose on people. You know, it's looking at the success results from this, getting the feedback from the users and taking it back through that loop. So some of the activities that we'd go through on there is, you know, workshops to align on the use cases and really understand those user personas. Developing of that high-level adoption plan, the communication strategy, and then you get into the training after that. And then the really important point here is getting your champions network together and having a number of champions spread across the organization that people respect. You know, there could be in a senior position, but it could just be that person in that department that people respect and they go to, and they're the ones that will be the ongoing champions. And then with the training content and on demand on things. Apply that as a proper structured process, and you're more likely to get success of these things. And because remember, with these sort of technologies, often with technology, you're replacing a previous system. They've got some sort of benchmark for it. With these sort of things, it's maybe going to be totally new, totally alien. So you've got a different set of challenges to overcome on getting that adoption, and you need to take that structured approach to do it. So some of the things that we do in our capabilities on here now we've been supporting. So we resell a whole load of hardware. You know, in Hololens is the biggest thing that we do by far. Then we've got a portfolio of applications that we're building up of third-party application services through our Insight Marketplace. We've got about 40 organisations now on that marketplace, and we've been working with Health Education England on this to go out to the market to look for these applications, and then to run an RFI process that feeds into HEE, and they feed back to us to say these are the priority apps that we want that fit within our training priorities. And then once they've given us that list of those priority apps, we go out and engage with those organisations and get them what we call procurement ready. So we get them signed up to NHS terms and conditions so that it's easy to transact with those organisations. If they're on the marketplace, you know that you can, they'll get through your procurement rules without any problem. And we've got some like 50 different public sector frameworks that can be transacted through. And then we wrap around all of the various services there that we do with that to complete that package. So there's a list of some of the tech partners we got fully signed up today that you can go out and procure and get deployed really quickly. And through some of the frameworks, you can actually do that as a direct call-off. So you could actually go out and ask us to procure on your behalf. We can get a direct award, and you can be up and running literally within days, rather than go through an elongated procurement process. So it's all about speed of deployment. So a couple of the things that you can see down on our stand. So we've got GigXR, one of our partners, anatomy and physiology training. Come and have a look at that. Put a headset on and go and experience it. So that's for anatomy and physiology. And then we've got the Holo patient, virtual patients with a number of different pathologies that you can go through and have structured learning on. Again, come down to the stand, put on a headset, and let's show you how that works. And lastly, I'll just wrap up with another one that we've got down on the stand that we're showing from our friends at Join XR. So this is something that's been commissioned through us by HEE for mental health training. And I'll just show you this video, and then we can talk about that afterwards.
I'm 32. I'm married. I have 2 kids, a boy and a girl.
Hi there, Stacey. Would it be all right if we had a chat about how you're feeling?
I guess it can't hurt to talk.
It sounds like you're going through a really hard time. Can you tell me what's been happening?
My husband thinks my mood problems are back, like with our daughter.
And how do you feel?
I am a really bad mother. I need to get home for my daughter. Listen, I just can't do this right now. I hope you understand.
Okay, Stacey. It sounds like you're going through a really difficult time. I'm going to see what we can do to get you some help.
Okay, so I think that's a great use of technology to do those sort of things. So you can experience it down on our stand, and experience is the word with this stuff. So we're down on stand G1 at the end. We've got this free VR headset that we're giving away for you. You've also got the chance to win a Surface Duo Pro 2, I think there's going to be a draw for those. So there's going to be 2 of those available. So come and understand, give us your details, and you've got to be in it to win it. Thanks very much.
Thanks ever so much. Perhaps you could show your appreciation for our speakers this morning. Phil, Alex, Joe, do you want to come back? We've got 5-6 minutes for some questions if anybody would like to ask. I mean, I've got to say, gentlemen, it's absolutely fantastic to see this technology coming to life and real game-changing stuff. I've been involved in holographic technologies for 7 or 8 years, but to see this applied during COVID and what rolled out on the wards and in care homes and stuff, absolutely fantastic. The training is brilliant. I understand the statistics of improved knowledge retention. It's just great. Listen, audience, come on, who's got a great question? Yeah.
Thank you. It was very insightful how virtual reality can help people to speed up the processes and so on. But I was wondering about what is current Microsoft position regarding the wearables, because I didn't hear much about it. If I may recall, you had a product which was called Microsoft Band, and it's not actually anymore something which is in production. Please correct me if I'm wrong. But what's your current opinion regarding this part of the market? Thank you.
Not my field of expertise, but in terms of Microsoft's fostering an ecosystem, you may have heard of IoT, and we're working with industry to embed this technology in a secure way in wearable devices. So I can't speak on specifics there, but that is the direction that we've been going. So it's fostering the ecosystem of OEM providers that have our devices embedded and can use our cloud services to build solutions in the healthcare sector or other sectors.
Hi, it's not so much a question. I think it was just to say thank you. This is incredible. I'm a former surgeon. I left the NHS now many years ago, but this was exactly what we needed then. So it's brilliant to see it happening now. It actually makes me really emotional because I remember at the time thinking, God, if we only had a way of, bringing that consultant, and we used to have to drive for hours to an MDT meeting, and it was just crazy use of time. So thank you. One thing that always comes back to me, though, is as a surgical trainee, is the feedback that you don't get from a real-life situation, both technically and in terms of the tactile feedback, but also the mental stimulation of the oh my God moment when you're in a situation which could be a crash situation. So how have people kind of fed back on that, please?
Sure. So I think it's a really good question, especially when you're talking about holograms and things like that. If there's a hologram on the floor of a person and then you go to touch them, your hand's just going to go through them, right? It's a digital representation of something. What I really like to talk about is that blended reality, and we have a partner on our stand, Velicus, who actually have a CPR dummy, and then what happens is when you put the HoloLens on, you see a real person that's in distress that needs CPR applied to them, but because there is a physical dummy there, you actually are getting that tactile feedback whilst being trained on like what the proper way to do things. But it is a good point, right? Because with holograms, they are not physically there, right? So, but I quite like the Velicus demo for that, right?
Yeah, that's a good example of, and why mixed reality is different than virtual reality, because you're overlaying on the physical world. You can build up that muscle memory, and we're starting to see examples of it used in training. So it might be completely digital, and you can repeat that and do that anywhere. For example, the Case Western with anatomy training. Some Case Western's moved away from wet labs, so they can really scale and increase the training for anatomy. You can do that anywhere. During COVID, they gave all their students a device and they were able to continue their training. But there's no substitute for actually then applying that. But then when they come to apply it, they've got more experience. But I think it's an area that we're going to see further develop. Haptics is an area, and having that feedback loop. Yeah. Absolutely.
Yeah,
it's a great analogy, flight simulator for surgeons.
We were speaking to a head and neck surgeon yesterday about putting tracheotomies in and training sort of relatives to do that for a patient when they're at home, and which can be quite a daunting prospect for a non-clinician to do those sort of things. So we're talking there about having starting off with a holographic model to train them on how to do it. So getting used to the steps of it, the things to watch out for. So you start off with maybe with a holographic model that you can do without having to have a mannequin or anything. Then maybe you move on to doing it with the mannequin and actually having a bit more physical contact doing it, but you're pre-prepared for that. And then the final stage is then we're actually doing it on the patient, and then it's maybe less scary at that point because you've got some sort of basis to work on.
Quick one from me. Thanks for the presentation, guys. Question on the image quality for the mixed reality when the clinicians are doing their ward rounds. Are the images coming up radiological quality for diagnostics and potential treatment planning, or is it just more for a quick look?
So with that example, you saw medical image data put into the field of view of the surgeons for reference. It's not for diagnostic purposes, so it's more as a communication tool. We expect the surgical planning and diagnostics would be in a certified platform by one of the, example of Popular, have that kind of certified technology. Does that answer your question? Yeah.
Okay, anybody else? Then I'd like to, one more.
Are you planning to add any haptics to it, like haptics glove or something like that with the HoloLens? Because Meta took it, and haptics is a nice company as well as a device. Are you planning to do anything like that?
Microsoft ourselves, we work with partners, so some of the partners are experimenting with haptic gloves. I know one of the partners who's for surgical training have integrated it into haptic devices. That's more of a virtual reality experience. But I think it's something that we look to our partners to bring together. If you've got a solution, you can come and talk to us about it.
Sorry, it's a random one, but I was wondering about cleaning it. I was thinking particularly with COVID and, looking at the clinicians going in with all of their gear, and most of that's going to be disposed of afterwards, but obviously the headset's the same. I'm assuming something's been thought of for that, but...
Yeah, if you come down to the stand, you'll see that we've got these UV cabinets. So for UV cleaning, you can put the devices in. Takes on about 60 seconds or so to do a UV clean. There's also a cleaning protocol to use with wipes and things like that. And you've got replaceable brow pads on there, which is the foam bit at the front. You can take those out, and what we're seeing some organisations do is just issue out people with their individual brow pad. So they put that on, they do it. So you clean the main unit, but put your own brow pad on. So it's got through, infection control at every hospital it's been deployed at.
Sorry, I just have a quick question, deviating away from HoloLens, if that's possible. So one thing that I was quite interested in is the medical waste, back to what, Alex, you've been talking about with Microsoft. So a lot of these wastes are infectious, so they have to be incinerated and cannot be reused or recycled, and most of them are indeed plastic. So how do we reckon we can come across tackling this issue in the future?
So I think that's a great question, especially in regarding the medical space. And I think you go back to those kind of 5 R's that I was talking about, like reduce and stuff like that. So I think this would fall into that reduce perspective. So, if we're thinking about medical waste that can't be recycled for obvious reasons, then that has to go to landfill in those scenarios, or be disposed of in a secure or safe way. However, there's plenty of additional waste from medical scenarios that are plastics that could be recycled but aren't. So I guess it's using data to identify where the opportunities are for increasing our sustainable kind of credentials within the healthcare sector.
Thank you very much, audience. Oh, sorry, did you want to comment on that last point? Or?
Just briefly, I guess, mixed reality, virtual reality, but dematerialising the real world, so reducing the amount of waste you need in the first creation of products that you need in the first place until you actually really need to use that. So I think that's an area that mixed reality can help with. But I also, to your point, I think there's a lot of opportunities to reduce waste in the training scenario. If you're working with catheters and things, there's single use even in the training environment. I think University of Michigan have been looking at this actually, and how to close the loop and work with suppliers so that you actually get a reuse of those devices. I think we can all play a role in that.
Fantastic. Listen, audience, thank you so much for your questions. Thanks for your interaction. Thanks for your attention. I hope you've enjoyed this. To Phil, Alex, Joseph, thank you very much for the session. We're going to finish off here now. So, gentlemen, thank you very much indeed. We're going to invite Ian to the stage, who's from Better, who's going to talk to us about low code on EHRs.